Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. As the exam is approaching us, shall I read this? Shall I read that? We are in a panic. Any student will be in the similar situation. There is no exception. Because the stakes are very big, almost 300,000, 3 lakh students are competing to be into the top 5,000 ranks to get into the government college. So you ask any topper, what is the secret? How do you win the neetpg? Any topper will say the same thing. Hey, there are 10,000 PYQs. Revise these 10,000 PYQs at least once. You are guaranteed to solve almost 80% of the question paper. But what is the problem? आज करेगा कल, कल करेगा परसों और परसों करेगा बरसों. Postponement is one of the biggest syndrome in our life. मैं अच्छा पढ़ने के बाद नीट पीजी पीवाईक्यू क्वेश्चन बैंक को एग्जाम कंडीशन में सॉल्व करूंगा, आज नहीं कल करूंगा, परसों करूंगा. Like that you will keep delaying. So that is the reason what we have done is we converted these 10,000 question bank in the past 10 years. 10,000 question bank of NEET PG. In 2015, there used to be around 2,000, 3,000 questions released, right? So we converted all this question bank into single liners, and every high yield fact based on the MCQ given in the exam, we classified which topic it belongs to, and every 1,000 high yield facts, which are the single liners of the PYQs, we created into an e-book for you to fatafat do the revision. So in the next 10 days, I'm going to launch Sprint 7, Sprint 8, Sprint 9, Sprint 10, Sprint 7 to the Sprint 16. These 10 Sprint ebooks on the learnograph.com are going to be the single liners into which the high yield facts are being created from the MCQ actually given in the NEET PG exam for you to cursorially revise. Ravi Bhai is saying, I'm a fan of your style of explaining and concising. I'm also your fan, Ravi. To be a wonderful student to join. So you are all the inspiration. Today morning I have seen and admitted one case of prostate carcinoma urosepsis. Another patient had obstructive sleep apnea, and one case of fulminant hepatic failure I got admitted. So the whole morning while practicing, I was thinking, hey, when will I go home, sit with the kiddos and do the revision, just like I'm also preparing for the NEET PG. So thanks to give this opportunity. Nice to see Sindhu, Mohan Pawar, and everybody. Hope the voice is loud and clear for all of. And please go to the learnograph.com link below and please download the ebook PDF. It just costs you 300 bucks, but almost 1,000 MCQs are consolidated topic wise, right? So the sprint number 7 ebook to sprint number 16 ebook, you get all the 10,000 high yield facts. Sit with a friend, no problem. You share, one of you buy and then give to 2-3 friends also, no issues. But sit together, fatafat, last moment, antim yatra, you have to finish doing the revision of the single liners. So Sai Pavan is saying, how can we get the PDF, sir? Below you have the learnograph.com link, doctor. I leave the link below. You go there and it is a e-book store. You can just pay 300 bucks and there you have Sprint 7, right? So that is what we will do. And otherwise, you can even call or WhatsApp 9000 868-356, or otherwise I left another helpline number below. You can call Mary. So let's make the great beginning, doctor. Now, so this is the Sprint 7 ebook, and we have the 2019, 20, 21, 22, the PYQs of the exam. So let us start, doctor. Now, once you come, I have summarized all the 1,000 facts. Now, let's start. An aneurysm of the anterior communicating artery, which is the part of the circle of Belize, compresses the optic chiasma, leading to vision loss. Don't forget. And why you need to remember about posterior communicating artery, PYQs aneurysm. PYQs aneurysm compresses the oculomotor nerve, third cranial nerve, whereas ECOM aneurysm is the one which is most common cause for the subarachnoid hemorrhage, and it can even compress the optic chiasma, leading to the vision loss, is what you need to remember. So everything about optic chiasma, circle of Willis, all these things, fatafat revision karna if you are not already good with. Okay. Active surveillance is the preferred treatment option. Can the online students punch, doctor? Are the letters clear for you? The PDF may, whatever the letters. This ebook is also available to you on the learnograph.com for you to buy. So are the letters clear? Very good. Thank you, Kuldeep, for the feedback. It is loud and clear. Very good. Around 15 students just purchased the Sprint 7 ebook. Let me also quickly open the video. 1 minute. Yes. Very good. Thank you, Sindhu, for the feedback. Yeah. Good. Now, doctor, active surveillance. What is the preferred treatment option for a 85-year-old with prostate cancer, Gleason score 6, prostate specific antigen 8, and 2 into 3 centimeter nodule? It is the active surveillance which is the preferred method. Now, direct hernia. How is it related to the inferior epigastric artery, doctor? Direct hernia. Direct hernia is below the inguinal ligament, medial to the inferior epigastric artery, not lateral, and you will manage it with Lichtenstein's repair is the favorite question of the examiner. Beta 2 microglobulin. What is the poor prognostic factor of multiple myeloma? Every neetpg exam, there is definitely a question on multiple myeloma. Beta 2 microglobulin is the poor prognostic factor in multiple myeloma. Then you should know about the fetal circulation. Umbilical artery carries the deoxygenated blood, even though it is an artery. Umbilical vein carries the oxygenated blood, is what you need to remember. One monoclonal antibody definitely will be asked in exam. Tocilizumab. It is an immunosuppressive drug which is used for the rheumatoid arthritis, and it is a monoclonal antibody against the interleukin 6 is what you need to remember. Now, anthracotic pigment can be found in the hilar lymph nodes. in a patient who has squamous cell carcinoma of the lung. What is the histological hallmark of the squamous cell carcinoma, doctor? Squamous cell carcinoma में होता है keratin pearls. Keratin pearls is what you need to remember. These are all the questions, single liners, high yield facts based on the neetpg 2022. Circumvallate papillae, they are the large papillae located at the back of the tongue, and they are called circumvallate because of the circular arrangement and taste buds. A lot of times, taste buds type of the papillae on the tongue is a favorite question. The lesion of the left optic nerve typically will cause the right half vision loss in both the eyes. So, hemianopias, quadrant anopias, all these visual pathway lesions, where the lesion, where do you get superior quadrant anopia, where do you get inferior quadrant anopia? If the parietal lobe involvement is there, what do you get? Temporal lobe involvement is there, what do you get? Where do you get macula sparing? Typically in the occipital lobe lesions, you get sparing of the macula. All these things you should be good, doctor. If you ligate the Wharton duct during the submandibular gland excision, what will happen? There will be a lingual nerve damage. Now, typically, the surface marking of the vagus nerve, how do you test the vagus nerve? You need to be very sure. So typically, the vagus nerve can be tested by touching. There was an image given on the skull base, at the level of the skull base. So one question on cranial nerves: Gesserian ganglion, sphenopalatine ganglion, pterygopalatine ganglion, otic ganglion, ciliary ganglion, and what is the vocal cord nerve supply? Above the level of vocal cords, below the level of the vocal cords, all these things you need to summarize for the tomorrow's exam. Now, the vertical and downward descent of the spleen, whenever the splenomegaly is there, spleen is located on the left side. But whenever it enlarges towards the right iliac fossa. So, why it is not descending down towards the left iliac fossa? Because phrenico-colic ligament between the diaphragm and the colon, you have phrenico-colic ligament that prevents the vertical and downward descent of the spleen is what you need to remember. Now, what is the composition of intracellular fluid, extracellular fluid? You need to be very sure. Every time a question comes, which is potassium principal intracellular cation is which one, doctor? Potassium. Principal extracellular cation is sodium. So this is what you need to be very sure about. So whenever respiratory alkalose is there, the alkalotic pH, what will it do to the albumin in the blood? Typically, the albumin, the number of negative charges on the albumin will increase whenever pH is alkalotic. So, whenever the negative charges on the albumin increase, they capture the calcium ion. So, free calcium, more and more of free calcium convert into bound calcium. So, free calcium is not available and you get tetany. So whenever a patient, when do you get respiratory alkalosis? When you hyperventilate, you get respiratory alkalosis. When you hypoventilate, you get respiratory acidosis. So a hyperventilating person develops respiratory alkalosis that will increase the negative charges on the albumin and that will capture the calcium ion and the free calcium become decreased and that lead to the development of the tetany is what you have to basically remember. Now, tricuspid stenosis, large A wave in the JVP. mid-diastolic murmur, pedal edema, right heart failure. They're all the features that suggest tricuspid stenosis. Whenever there is a diplopia, tingling, numbness, and worsening with heat, it is multiple sclerosis. Multiple sclerosis is a condition of demyelination. Demyelination occurs because myelin is formed in the central nervous system by oligodendrocytes. So oligodendrocyte defect is the underlying problem leading to the demyelination. So what is that symptom called? Worsening with heat, Lermit's symptoms, which you typically get in case of multiple sclerosis, is all because of the demyelination is what you need to remember. Postprandial glucose primarily comes from where? It is the glycogenolysis in the liver which is primarily responsible. Once more, glycolysis, gluconeogenesis, glycogen synthesis, glycogen degradation, galatus metabolism, pentose phosphate pathway, beta oxidation of fatty acid synthesis. So, and similarly, cholesterol metabolism, bile salt formation, porphyrias, then purine and pyrimidine metabolism, urea cycle, all these things. There are totally around 20 cycles. They're regulating enzymes, allosteric enzymes involved. Everything you should know when you go for the tomorrow's neetpg doctor. It doesn't take much time. There is a quick capsule book which is called Snapshots in Biochemistry, available on the learnograph.com. Please take opportunity to do the revision, right, doctor? Now, mismatch repair. Very good, doctor. Just now 23 students downloaded the Sprint 7 book containing 1000 questions converted into single liners and the topics. The whole purpose of PYQ is what? Where to focus, what is there in the examiner's mind, to know that once you solve this 10,000 PYQs, at least as single liners, and know what topics questions are coming, you will be एकदम रेडी, तलवार के तार के जैसे तैयार हो जाओगे परीक्षा के तैयारी में. Now, doctor, hereditary non-polyposis colorectal cancer, it is the mismatch repair defect is what you need to remember. Now, pyruvate dehydrogenase complex, what will it do? It will convert pyruvate into acetyl-CoA. Pyruvate dehydrogenase complex. And it has got dihydrolipoyl trans-acetylase. So, thymine is very much required for the pyruvate dehydrogenase complex. Whenever a maize diet eating person is there, they develop niacin deficiency. Diarrhea, dementia, dermatitis, finally death is the part of the niacin deficiency. So, cystinuria, cystathione beta synthase defect, whenever it is there, then the dietary cysteine supplementation need to be given. Now, whenever there is an elevated serum cholesterol and LDL cholesterol, then it is familial hypercholesterolemia. So there is a Fredrickson's classification of hyperlipidemia, which you need to be very good with. So you should know what is the inheritance pattern of each of them and what is the fundamental defect in each of the types of hyperlipoproteinemias you need to be very, very sure about. There's a weakness, anemia, bony pain, hepatosplenomegaly. Gaucher's disease is due to the deficiency of glucose erythrosidase enzyme is what you need to remember. The transparency of corneal epithelium is maintained by keratin sulfate. That is the reason if you take Hunter's disease, Hurler's disease, mucopolysaccharidosis, in Hurler's disease there is a corneal opacity. Hunter में corneal opacity नहीं है. A patient who has pellagra with niacin deficiency image was shown, and you are asked to identify that it is pellagra. Very easy. So we have 50 full-scale grant tests, of which 30 to 40 image-based questions are asked. And all these 50 full-scale grant tests, their explanatory answers containing 200 mind maps are made available on the learnograph.com. Doctor, today only take opportunity to download from the learnograph.com and do the revision. Dark urine that blackens on exposure to air in alkaptonuria is because of the homogentisate dioxygenase deficiency. Then electron transport chain inhibitors is a favorite MCQ in the neetpg. Oligomycin inhibits the ATP production in oxidative phosphorylation in mitochondria is what you should remember. So what is phrinoderma? A frog toad-like skin. So corneal drying, Bitot spots, night blindness, vitamin A deficiency में होता है phrinoderma. So what is the condition where there's a developmental delay, chest infections, bony pain, unresponsiveness to vitamin D resistant rickets it is called. It's called X-linked hypophosphatemic rickets. So what is the inheritance pattern of the X-linked hypophosphatemic rickets, doctor? It is X-linked dominant. You have a lot of conditions which are X-linked recessive, but very few are X-linked dominant, and that is hypophosphatemic rickets. The glucose in the gut, which SGLT transporter is involved, SGLT1 transporter. So where is SGLT2, 3, 4 in the kidney? What is there? And how the dapagliflozin, empagliflozin, all these diabetic drugs act on SGLT receptor in the kidney. So all these things you should revise. In an alcoholic individual, if you do liver biopsy, then it contains intermediate filaments which present like Mallory bodies is what you need to remember. Benzene is a carcinogenic agent. Long-time exposure lead to blood cancer. So what is meant by dysplasia? Dysplasia is a disorganized growth. Metaplasia, dysplasia. Dysplasia is precancerous. Metaplasia means one mature cell becoming another mature cell. Dysplasia means it is a disorganized growth with hyperchromatic nuclei in a pap smear indicate dysplasia. So what happens to transferrin saturation in iron deficiency? It decreases. Ferritin level decrease in iron deficiency, but ferritin level increase in anemia of chronic disease. Every time they ask this question, thalassemia versus iron deficiency anemia versus anemia of chronic disease versus sideroblastic anemia. So you need to be ready with that table of these different types of anemia. How do you differentiate lab-wise? So we have the snapshot review books for every subject. We are uploading the snapshot review. In snapshot, it is in the form of mind maps where there are 2 MCQs and about 10 points given, and every subject is revised in around 2000 high yield facts along with typically 500 to 600 MCQs that you need to master. So already we have the around 4 subjects. Obstetrics is uploaded. So the whole art of winning entrance exam is not very in-depth knowledge. It is broadly you should know what examiner want to know from you, and try few questions which are commonly asked about it. 5-6 points about each topic. Bas, you are ready for the exam. Pancytopenia and macrocytes on bone marrow biopsy. What does it indicate? Aplastic anemia. Always remember, whenever patient is having pancytopenia, there are 2 possibilities if you do bone marrow. Either you get a hypocellular bone marrow or a normo to hypercellular bone marrow. So pancytopenia with a hypocellular bone marrow का मतलब क्या है? Bone marrow, which is the factory to produce WBC, RBC platelets, it is not able to produce. Factory level में ही गड़बड़ है. Factory घोटाला हो गया. So in that case, it is called aplastic anemia, where you get pancytopenia with hypocellular marrow. Whereas bone marrow is okay. It is producing RBC, WBC and platelets, but they are getting peripherally destructed. So you should look. Splenomegaly, hypersplenism is a cause. Similarly, if there is an SLE, there are autoantibodies against WBC, RBC and platelets. There also, marrow will be hypercellular, but there is a pancytopenia. So what are the two causes you remember for a hypercellular marrow with pancytopenia, SLE and hypersplenism? Whereas in aplastic anemia, you get pancytopenia with aplastic bone marrow. That is what you need to remember. Similarly, folate deficiency. A diet lacking fruits and vegetables, hemoglobin is 9 and MCV is increased to more than 125 means you need to think about folate deficiency. So two conditions, vitamin B12 deficiency and folate deficiency, lead to megaloblastic anemia. What are the causes for a macrocytic non-megaloblastic anemia? See, folate, vitamin B12 deficiency or macrocytic megaloblastic anemia. Whereas macrocytic non-megaloblastic anemia, what are the causes? Liver disease, alcoholism, hypothyroidism. और एक बार बोलो मेरे साथ, liver disease, alcoholism, hypothyroidism. These three will be responsible for non-megaloblastic but macrocytic anemia is what you should remember. Ultrasound shows streak ovaries in a patient with Turner's syndrome. Turner is the cause of the primary hypogonadism is what you need to remember. So where do you see Ashkoff bodies, doctor? Rheumatic heart disease. और एक बार फटाफट जाना गूगल इमेजेस में देख लो Ashkoff bodies कैसे दिखाएगा. कल के नीट पीजी में भी Ashkoff body इमेज बेस्ड क्वेश्चन आ सकता है. All right, doctor. Now, what are the markers, CD markers of follicular lymphoma? CD10 and BCL2, these two are the markers. So, there is a list of condition, what are the CD markers? Favorite question of the examiner. Mantle cell lymphoma, what are the CD markers? Right? So, please today only go back to that list and do the revision because very recent neetpg 2022 में follicular lymphoma CD markers के ऊपर चर्चा हो गया. हर एक neetpg में one question on leukemia, one question on lymphoma, one question on polycythemia like myeloproliferative conditions. Without that, there is no question paper. Similarly, हर एक neetpg में oral contraceptives के बारे में दो question आएगा. वेस्ट मैनेजमेंट में which कलर बैग के ऊपर एक क्वेश्चन आएगा. Like that you can predict, doctor. You can easily predict. Provided 10,000 PYQs कम से कम एक मर्तबा खत्म करना. If you didn't finish PYQs, you are not eligible. Don't even dream, right? एक मर्तबा तो उनको नजर देखना. Forget about whether I will remember CD10, whether I remember BCL2, वो सब छोड़ दो, right? So every sprint book में from sprint 7, 8 up to 16, 1000 high yield facts, the previous MCQs को single liner बना के topic wise classify करके आपके reference के लिए दे रहा हूँ. And also tell your juniors, when they start the preparation, first, whatever be their knowledge level, they need to go through all these 10,000 PYQs. एक मर्तबा ऊपर से नीचे गए तो finish, you will become topper. Very nice to see 23 online classmates, Joshua, Ravinder Singh and many more. So please don't forget to like this video, share this YouTube video link to in all your social media groups, Telegram, Instagram, any gram that is there. Please tell your friends about learnograph.com where they can download the link. right? But ultimately, let all of you do the revision with Dr. Murali Bharadwaj. And unless you like it, and at the end of the session, please do comment. If you do comment and share in your social media groups, then this becomes viral. And you're all my brand ambassadors, doctor. Palpable purpura is a vasculitic purpura. Oh, sorry. Before that, there was a question. A patient has splenomegaly and his bone marrow is being shown. So it is typically myelodysplastic changes are there. So what is the next best investigation? Means FISH and PCR are the next best investigations. Palpable purpura is a vasculitic purpura along with arthritis, RBCs and protein in the urine. It is typically Henoch-Conlin's purpura. Henoch-Conlin purpura on one side, IgA nephropathy on the other side are the two ends of the spectrum, is what you need to remember. In bladder cancer, what do? Radical cystoprostatectomy need to be done, and such a specimen is being shown to you on the bladder cancer. Always about the bladder cancer, you remember, any elderly person presenting with hematuria, coming and telling that in my washroom, in the French toilet, there is a blood. Hematuria, unless proven otherwise, in a patient who is above 50, is assumed to be because of the bladder cancer. So how do you correctly prescribe alprazolam? Tab alprazolam 0.5 mg once a day before bed for 7 days, right? And it's a prescription drug, Schedule H drug. Only with the prescription is supposed to be sold, at least theoretically speaking. So what is meant by dosing rate? Dosing rate is the rate to maintain a steady state concentration. It depends upon the clearance and the target plasma concentration. Once more, doctor, volume of distribution, dosing rate, first order kinetics, zero order kinetics, all this bioavailability, all this pharmacokinetic may 10 to 12 parameters, formulas, half-life ka formula kya hai? Just quickly you need to do the revision, doctor. Now we are talking about the neetpg 2022. Already we finished around 45 questions. So fast way you need to revise. Don't go too deep into paragraphs and paragraphs of information about each MCQ. It's a waste of thing. Latanoprost is used to treat the open angle glaucoma wherever the beta blockers are contraindicated, like timolol is contraindicated as in the patient of bronchial asthma. Low dose aspirin, what is the mechanism? Aspirin inhibits thromboxane A2 is what you need to remember. If you give indomethacin in a pregnant woman, it leads to premature closure of the ductus arteriosus in the baby. Always remember, prostaglandins keep the patent ductus arteriosus remain patent. P. The prostaglandins keep the patent ductus arteriosus to remain patent is what you need to remember. A patient has angioedema. So angioedema can be caused by the ACE inhibitors. So it was shown in the exam as an image, lisinopril and angioedema. And what is the best analgesic of choice whenever there is a renal disease? Very good, doctor. Another 12 students have downloaded the Sprint 7 ebook PDF from learnograph.com. Very good. So this gives you a cursorial revision of almost 1,000 questions of PYQs. Totally 10,000 PYQs will be released in 10 books, 10 ebooks. Now, doctor, digoxin toxicity. What are the drug interactions? What are the P450 inducers, inhibitors? You have to be very, very sure, doctor. So, clarithromycin can lead to digoxin toxicity drug interaction. Whenever chronic renal insufficiency is there, serum creatinine is 1.9, then how do you manage hypertension? Clonidine can be given in renal failure patients. It comes as a brand called Arcamin. Arcamin 100 micrograms. We give TID also. Very good in controlling refractory hypertension and very safe, completely safe. Clonidine in renal failure. Chlorothalidone can also be given in renal failure. So, in pregnancy, which class of antihypertensives are contraindicated, doctor? Lisinopril. ACE inhibitors are contraindicated if the women want to become pregnant. 36-week-old pregnant female, gestation of pregnant female on warfarin. So in pregnancy, warfarin should be stopped and you need to give heparin. So typically in the first trimester, we don't give warfarin. We give heparin. Then we can give warfarin in second trimester, and once more before delivery, we switch on to the heparin. So that is the protocol. Because if you give all 9 months the heparin, it can lead to the development of osteoporosis as the complication. That's what you need to remember. Very good to see 28 online students. Excellent, doctor. So please don't forget to make this video viral. Please mention in all your social media groups. Please click on the like button. Write a few comments how you felt about the sprint sessions, etc. in the comments, not in the chat window, but in comments. So that will help the video become viral. Now, doctor, rifampicin, if you give among antitubercular drugs, rifampicin is called Raja, the most powerful. It can lead to P450 induction, leading to OCP metabolism and leading to the failure of the OCPs is what you need to remember. When taking metronidazole, patients should avoid alcohol to prevent disulfiram-like reaction. Methotrexate, what is the mechanism? It inhibits the dihydrofolate reductase. In the exam hall, agar ye yaad nahi aaye to, yeah, Joshua is saying, I am late, sir. You are late, but latest arrival, Joshua. Yeah. Now, what are enrichment media? Enriched media, selective media. One question on culture media will come because 2022 neetpg 2022 most recently it has come. Selenite F broth is used to isolate organisms from stool samples as a enrichment medium. Pseudomonas aeruginosa is a obligate aerobe that can infect the burn sites, and it is identified with positive oxidase test. HIV patient with CD4 count less than 55, fever, chills, productive cough, has pneumocystis, pneumonia. What type of virus is measles, doctor? It is a ssRNA virus. It leads to fever, coryza, conjunctivitis, maculopapular rash, which starts on the face and the neck. So everything, anything about the measles, Koplik spots, identifying them in an image-based question is very much required. Subacute sclerosing panencephalitis, SSPE, is a late complication of measles is what you need to remember. Staphylococcus aureus has a very short incubation period, less than 6 hours. It releases enterotoxin which lead to vomiting after eating contaminated food because that preformed toxin will be there in the contaminated food. So there are 2 important food poisonings which typically have a short incubation. One is Bacillus cereus. So somebody ate a Chinese rice, right? Classical story. Immediately within 1 hour there is a diarrhea, means Bacillus cereus. Similarly, Staphylococcus aureus also very short incubation period. Similarly, Vibrio vulnificus also can lead to development of the food poisoning on eating the seafood, marine food, you get Vibrio vulnificus food poisoning. So everything, anything about food poisoning, neetpg mein favorite area. Swab material from the pharyngitis discarded in yellow bag. So each of the colors of the bag, what is the classification of the waste material, you have to be ready, doctor. So very good. Already we finished 60 items in the NEET-PG 2022 paper. खेलते खेलते 2-3 घंटे में आप पूरा 1000 हाई यील्ड फैक्ट्स PYQs को रिवीजन मार देंगे. और next 10 दिन, next 10 days, let us completely focus on what are the priorities of the examiner. First, you know that you already cracked the exam. So don't go through big fat books of PYQs with a lot of explanatory material. All that is bullshit. You don't get time to revise. This is a very fast way to do the revision quickly, right? So tell your juniors, whenever you start preparation, download the sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 10 ebooks, each containing 1000 PYQs converted into single liner with the topic classification, will bring you first orientation, awareness, what examiner is asking, आजकल क्या हो रहा है exam hall में, what I am expected, what I am going to face. First, you need to know that. Otherwise, you will have unexpected expectations about the examiner. And every time you will be panicking, ये पूछेगा, ये पढ़ना है, वो ऐप में plan ये लिया, वो plan B लिया. What is your plan, doctor? Your plan should be simple plan. You don't need more than 200 hours of time with Dr. Murli Bharadwaj for you to become the topper. Now, doctor, prozone phenomena. It caused a false negative result in the agglutination test. False negative. That means, even though brucellosis is not there, it will say it may be there. So typically, false negative result in a standard agglutination test for brucellosis. How can you prevent the prozone effect? Provided if you dilute the serum properly. So disinfection of the blood spills, how will it do? Sodium hypochlorite. So all disinfectants, 1-2 comments you need to know when you go to the exam. You can expect it in the exam. Wedge-shaped perforations in the hair shaft is seen in tinea mentagrophytes infection. So a lot of image-based questions come on the tinea, doctor. Dermatophyte infections, you need to be very sure. Wuchereria bancrofti. Nowadays, it's the favorite question of the examiner to give you the parasitic larvae and expect you to identify the microfilaria. So, Wuchereria bancrofti versus Culex, all these microfilaria, how do you recognize? Onchocerca, how do you differentiate? Just go through the Google images and try to know. Now, small larvae seen in the bronchoalveolar lavage in a patient on chronic steroids with worsening symptoms indicates strongyloides turcularis. To look at the motility of the organism, who has a painless demarcated ulcer on the penis, that is syphilis, treponema, you need to use dark field microscopy. So once more, syphilis, primary syphilis, secondary syphilis, tertiary syphilis, differences between the two, right? And what are the VDRL tests? What is FTA ABS test, and which is most specific? What are the false positive causes for the VDRL? ये सब चीजें एक मर्तबा रिविजन करना. अब सबके स्टडी मटेरियल्स में रहता है ये सब चीजें. But that is important for examiner because it is asked in 2022, is important for you to know. So please go to the learnograph.com, doctor. वहां आपको microbiology snapshots बोल के एक PDF मिलता है. 150 माइंड मैप्स में पूरा माइक्रोबायोलॉजी में आपको जो भी बट्टी मारना है, रट्टा मारना है, वो सब available है, right? Now, sandfly is the vector for the parasites with kinetoplasts leading to fever, pallor, hepatosplenomegaly, leishmaniasis. Then you should know Kala Azar, visceral leishmaniasis, cutaneous leishmaniasis, everything. What is their life cycle? Everything you should know, doctor. Urethral discharge 1 week after unprotected intercourse, commonly is because of gonococcus. And any young man presenting with monoarticular arthritis, you should think about gonococcal arthritis. Incised looking laceration was shown as an image. So you should know that in forensic medicine, abrasions, lacerations is a favorite question. So a post-mortem lividity, the change in the color of the cadaver is being shown to you, which is because of the sulfhemoglobin is what you should remember. Did A kill B is a direct question. So this kind of leading questions are only permitted during the cross-examination, but not during the direct examination is what you need to remember. Bareba, 30 online classmates I am very happy to see. So every day I upload 1,000 PYQs as high yield facts with topic classification for you to get the quick awareness and focus the last moment revision. So please join every day evening. And I upload this ebook on the learnograph.com. Please inform your friends and you can download, and just by paying around $300, you get each of these print PDFs. Bilvano poisoning. The active principle of the poison in the image shown was that of the bilvano. You should know in toxicology, one MCQ sure shot to come. Datura poisoning, arsenic poisoning. So these things, 4 or 5 points you should know when you go for the exam. So immersion in the water for 36 hours will cause immersion change, which is being shown as a image. So once more, drowning is a favorite question, doctor. What is wet drowning? What is dry drowning? What are the differences between the two? How do you know whether a person is alive when he was drowned? Is it antemortem drowning or postmortem drowning? All these things you need to do the revision. A child has irritability, agitation, constipation after eating a fruit. So what is that? Datura. Datura, what is the antidote? Physostigmine. Datura is typically anticholinergic. To treat that, you need to give cholinergic, which is physostigmine. Now, heat stroke. Sweat is least likely whenever you don't sweat but exposed to heat. Then you get collapsed, right? On a hot summer afternoon. That is the heat stroke. Then a case where DNA fingerprinting shows one of the two twins belong to the father is a case of superfecundation is what you need to remember. So you should know all these superfetation, fecundation in the multiple pregnancies. You need to know the definitions. Substance abuse, morphine, cocaine, amphetamine. What are their symptoms? Heroin. So tachycardia is a feature in cocaine poisoning, not bradycardia. A gradual swelling around the wrist, typically giant cell tumor with that soap bubble appearance has been given in the exam. So you should know one bone tumor, doctor. There is no question paper without a bone tumor. वो तो मैं stamp print करके बताता हूँ. Paper out, right? Every neetpg exam, at least 2 questions on bone tumors, at least 2 questions on ovarian tumors, 2 on endometrial cervical cancer, at least 2 on breast carcinoma, at least 2 questions on either BPH or prostate carcinoma. Very, very predictable, doctor. Just you need to be ready. with the 5-6 points about each of them. So, Prakash Baduria, I love your teaching style, sir. Very easy way and clear concepts. Thank you so much, Doctor. You think that we teachers are not vulnerable to the compliments? No, sir. We are very vulnerable. We are very, very vulnerable. We'll be waiting. तरसते हैं जब हमारा फैंस बनेगा स्टूडेंट्स. इसके लिए हम उस्ताद जाकिर हुसैन के जैसे बहुत प्रैक्टिस करके आते हैं इस सारेगामा प्रोग्राम में. So, any teacher, what is the true dividend of a teacher, doctor? The true dividend of a teacher is when he has a crowd of classrooms. That stadium is needed, just like Sachin Tendulkar requires audience while he is playing sixers. So past 25 years, the God has given opportunity to see wonderful students who were all sitting like you once upon a time, but now they are top consultants, neurosurgeons, cardiologists, cardiothoracic surgeons. We all practice together in Hyderabad. So one day you will become my colleague, another consultant to whom I refer the case, right? And we'll be discussing the real clinical case scenario management. So always have that big dream in mind, right? This is only a short journey that you are going to hit and make it happen, right? So what I like to tell all of you is focus this next 9 to 10 days purely on 10,000 PYQs. Quickly, अरे मुझे prostate carcinoma के बारे में पूछा है recently, मुझे prostate carcinoma जाके revision करना रे बोल के, if you get that feeling, just finish that. That is how the next 10 days without tension को नहीं जाना, right? Fill as many gaps as possible. Always what is important in life, doctor? You can't bring back the time. You can only do what all that you can do in the available time. फिक्रने से कुछ भी नहीं होता. Unnecessarily मन का चिंता और equilibrium निकल जाता, right? निश्चलता, निश्चिंता. They are the two things that you need to have in your mind when you are going for the exam. Why? Because tomorrow, what are you going to become, doctor? You're all preparing to become top neurosurgeons, cardiothoracic surgeons. You're puncturing and the blood is hitting the top of the operation theater. Will you fizzle out? No. You will be on the side. Patient is going into a VT, VF. You're doing the resuscitation. Will you fizzle out? No. So you should learn how to not fizzle out when the situations, circumstances are very testing and stressful. So that is the reason, give a focus, this 10,000 PYQs, try to do the revision. I'll upload quickly sprint 7, 8, 9, 10 up to 16. These 10 books each containing 10,000 PYQs summarized topic wise for you to cursorially do the revision. And wherever you're going feeling that I'm low, quickly go and then and there do the revision. So that's how you should become the winner, doctor. That is my dream for all of you, right? And to wonderful students like you, there is nothing to teach, honestly. There is more to inspire you to read the content. That is the whole job of a teacher, doctor. So let's continue our journey. हम देखते देखते ही we finished almost a good number of questions. Yeah, we almost reached 83 within no time. Now, chronic low back pain, early morning stiffness, bilateral heel pain, that's called enthesitis, is typically seen in ankylosing spondylitis. Similarly, Morning stiffness, backache, eye redness, scleritis indicate ankylosing spondylitis. Bamboo spine, favorite X-ray in the tomorrow's neetpg. So, whenever there is any Colles fracture, how do you treat osteoporosis, doctor? So, you have T score, Z score, whenever you do bone mineral density. So, whenever the Z score is between -1 to -1.5 standard deviation, you call osteopenia. More than -1.5, you call osteoporosis. More than -2.5, severe osteoporosis. So once upon a time, we used to give biphosphonates. Later on, we have teriparatide, which is the teriparatide, parathormone analog, which we need to do everyday injection for about 6 months. Now we are in the era of denosumab, 60 milligrams. Once in every 6 months. It is an osteoclast inhibiting drug, wonderful drug, but it costs around 17,000-18,000 rupees per patient. But only once in 6 months subcutaneously you can give. And we give salmon calcitonin inhalation to treat biphosphonates, to treat the osteoporosis. So if you did this question, you're not confident, just go back to pharmacology. 4 to 5 drugs which are used to treat the osteoporosis. Now only you read because 2022 mein pucha hai. X-ray of a 10-year-old child with a normal mineral bone density. So all the features of the scurvy, that is scorbutic rosary, Pelkins spur. So rickets and scurvy, the bone picture features, sure short question. Similarly, an X-ray was being given of posterior dislocation of the hip of a person who fell down from the bicycle. So you should know the attitude in anterior dislocation, posterior dislocation, typically in the lower limb. Favex, Fadir, flexion, adduction, internal rotation, flexion, abduction, external rotation. Where do you see between anterior and posterior dislocation, which is called dashboard injury? Everything you should master, doctor. Very nice to see another 18 students just now purchased the PDF of Spring 7. So almost before by the time our discussion reached here, 140 students have purchased the Spring 7 PDF. Very good, doctor. So you should know median nerve, ulnar nerve, radial nerve, musculocutaneous nerve, axillary nerve, and what are the various lesions in each of them. And in supracondylar fracture, what is the nerve involved? And in the lower part of the femur, in the radial groove, radial nerve injury will be there. Clutch palsy means radial nerve palsy. So all these things you should know, doctor. One question definitely will come in the tomorrow's neetpg from median nerve, radial nerve, axillary nerve, musculocutaneous nerve, and these basic brachial plexus, Erb's palsy, Klumpke's palsy, you have to be very sure, right? Now, difficulty in elbow flexion and supination with the loss of the sensation on the lateral forearm. What does it suggest? Musculocutaneous nerve injury. Sure, short MCQ. Musculocutaneous. See, in the single entrance only, they ask 2 brachial plexus nerves. Definitely, it will come in tomorrow's exam. 24-year-old with fever, weight loss, hip flexion deformity. Typically, is because of psoas abscess. Psoas abscess very commonly is because of the tuberculosis of the spine, is what you need to remember. If you want ideally to manage a 15-year-old with myopic astigmatism, who is refusing to wear the glasses, what will you give, doctor? Typically, we use spherical equivalent glasses is what you need to remember. Why do pupillary reflex and denucleation in the child? Where will you do? Retinoblastoma. So once more, doctor, you should know in retinoblastoma, whenever the RB gene defect is there, RB gene, what are the most common secondary carcinomas which can occur because the RB gene defect other than retinoblastoma? Osteogenic sarcomas are very common. Similarly, watering eyes, cloudy cornea, 1-month-old baby, what does it suggest? Congenital glaucoma. If there is eye pain, irritation, foreign body sensation in a contact lens wearer, what does it indicate? Giant papillary conjunctivitis. Please remember, giant papillary conjunctivitis. So, contact lens wearer में acanthamoeba keratitis is very, very common, doctor, that you should basically remember. Gradual painless vision loss with hard exudates in the fundus. Diabetic retinopathy. Once more, diabetic retinopathy, hypertensive retinopathy, how to identify what is the grade of hypertensive retinopathy? You have to be very sure. Diminishing vision in dim light with dry eyes and the roughening of the corneal surface is equal to vitamin A deficiency. So, whenever there is any facial nerve palsy, there is an inability to close the eyelid. Such patients will have exposure keratitis as a complication. A roomy nasal cavity with foul smelling yellow discharge, ozaina, is a feature of atrophic rhinitis. Subglottic stenosis, how do you treat, doctor? Topical mitomycin C is the one which is being used. Difficulty in swallowing and X-ray finding which is being shown in a 9-year-old suggests foreign body in esophagus. Once more, you need to go back to the Google images. How do you identify the tracheal foreign body, esophageal foreign body? Favorite question. Whenever recurrent nasal bleeding is there, you need to do endoscopic sphenopalatine artery ligation. Once more, epistaxis is a favorite topic, doctor. What is the blood supply of the Little's area and Woodruff's area and etc.? Everything you should know. School health is the primary. I think this was wrongly placed. Yeah. Now, tetanus and diphtheria vaccine can be administered to a 10-year-old boy attending school. Very much. Culture plates, how do you dispose? Yellow color bag. Whenever increased CRP levels are there, there is an increased risk of MI and stroke. And what is this called? Positive correlation. Similarly, whenever there is any progressive muscle weakness and stiffness in both the legs in a old farmer, you should always take their dietary history. What is the unit of brightness of a point source of the light? Candela is what you should know. Whenever you are assessing the clinical management in a health center, process evaluation is the most important step. So if you look at Britishers, they are very good managers because they are very good in the processes. Similarly, disaster management is one dirty topic in preventive medicine, but still you need to read it, doctor. Post-flood fever syndrome, how do you manage? Doxycycline and Paris green as a chemical spray. A live attenuated subcutaneous vaccine used for the mass vaccination against acute encephalitis syndrome is recommended in universal immunization program. Air quality index, AQI, 470 indicates very severe air quality. AQI should be less than 100 to be called good. Between 100 to 150 it is called moderate, and beyond 150 bad. That's what you need to know about the air quality index. AQI is what you need to remember. So a Kata thermometer is being shown very recently in neetpg 2022 and asked you to identify. So one instrument based MCQ is going to come in the neetpg exam, doctor. MMR vaccine is contraindicated in a female child with recurrent yeast and respiratory virus infection since the age 3 months. Now, infant mortality rate is not the part of the global hunger index. So similarly, you should know what is physical quality of life index, what is human development index, what is global hunger index. All these indices you should be sure. Once more, OCPs and intrauterine contraceptive devices. At least 3 to 4 topics will come, doctor. For a woman who missed 4 OCPs in 7 days, take the next pill as soon as possible and consider emergency contraception if the intercourse occurred in the last 72 hours. Inguinal and axillary buboes. Typically, it is the Xenopsilla chiopis which carries the plague, bubonic plague. In a patient who has a retrosternal chest pain recurrently, normal top eye, what is the next important step in the management? So, when the cardiac enzymes are normal, if there is no ST elevation or at least a LBBB on the ECG, then you can't give streptokinase or a thrombolytic agent. So, in that severe case, you can give heparin, low molecular weight heparin subcutaneously. So, how to calculate the sodium deficit is the favorite question of the examiner, doctor. So, if you look at 120 milliequivalents per liter, 120 normal sodium कितना होता है 135 to 140. चलो भाई 140 पकड़ लो. Between 140 and 120 means how much is there? 20 milliequivalents is there per every liter. 20 milliequivalents for every liter. In a 70 kg man में how much of the total body water? 60% of the weight. That is 70 में 60% is कितना हो गया? 42 liters. For every liter there is 20. So 40 into 20 is 800. So around 840 milliequivalents. और एक बार बोलो क्या? Very simple. Normally it is 135 to 140. 140 पकड़ लो. 140 milliequivalents of sodium should be there for every 1 liter of the total body water. 70 kg person में there are 70 into 60% is the body water. So 70 into 60% is 42 liters, right? So between 120 and 140, how much? 20 milliequivalents deficit is there for every liter. So 42 liters को 42 into 20 is 840 milliequivalents in the sodium deficit is what you should remember. Once more, doctor. Hyponatremia, causes of hyponatremia, correction of the hyponatremia, what is central pontine myelinolysis, all these things you should revise. ABG show pH 7.53 means alkalotic. PCO2 20 decreased means he is hyperventilating, so respiratory alkalosis, right? Respiratory alkalosis with hyperventilation lead to carpopedal spasm. Once more, Dr. लिख लो neetpg एग्जाम में एसिड बेस डिस्टर्बेंसेस के ऊपर अगर एटलीस्ट 1 क्वेश्चन नहीं है तो मैं इस्तीफा देता हूं मेरे मंत्री का as your coach I will resign, right? Sure, short, every neetpg 1 question. Chopstick sign, Trocheus sign, classical signs of respiratory alkalosis. A patient has urine osmolarity of 1000 and plasma osmolarity of 200. That means urine is very concentrated. That means there is no water entering into urine. And where is all the water going? Water is all going into the plasma. That's the reason plasma osmolarity decreased, urine osmolarity increased. What is that condition called? Syndrome of inappropriate ADH secretion. SADH is a state of hyponatremia, is what you need to basically remember. Once more, mark it as my word. SADH is the favorite MCQ of the examiner. For a child with congenital hydrocephalus and a VP shunt, blood culture from the peripheral blood and CSF sample is the next step if you are suspecting VP shunt infections. ये तो थोड़ा rare question है. There is no guarantee this will repeat, right? But hydrocephalus is one thing that is there in examiner's question bank. Patient has moderate headache, used medication for 3 years, has decreased headaches after stopping medication. What is that called? Medication overuse headache. Once more, remember, migraine, tension headache, cluster headache, trigeminal neuralgia, medication overuse headache. How do you differentiate between the four? Most headaches are all seen in female. The only headache seen in men is cluster headache. Headache associated with nasal discharge, rhinorrhea, autonomic nervous system, periorbital tearing pain as if the flesh is being taken away is the feature of tension, is the feature of cluster headache. A person who had got a stress in the history and all the pain radiating into the neck is a feature of tension headache. Closely related to menstrual cycle, unable to see the light, want to sleep in the dark room, he's not tossing at all, she is not tossing at all, scintillating scotoma are found. Typically the feature of migraine headache is what you need to remember. Very nice to see 29 classmates midnight masala show with Dr. Murali Bharadwaj. So डॉक्टर, जब भी हमको टेंशन ज्यादा आता है, हम ज्यादा पढ़ना है. That's how you need to overcome. And remember, you have कोई पूछे तो, अगर कोई पूछे तो, भाई मेरे पास ऐप है, प्लान ये है, फेस टू फेस क्लासेस है, बड़ा बड़ा नोट्स है, डिस्टिंक्शन स्कोर्स है, आप क्या बोलोगे? मेरे पास मुरली भारद्वाज सर है, हम रोज मिलेंगे, रोज पढ़ेंगे, जो एग्जामिनर पूछने वाला है उसी को पढ़ेंगे, बहुत कम पढ़ेंगे मगर अच्छा रैंक मारेंगे. That is what you need to tell yourself whenever you feel tense. Whenever you feel tense, the best treatment of feeling tension in the life is to solve the problem, solve the things. Right? So just read. There is nothing that we can do. So that's the reason. What is the prayer in the life, doctor? Every day when I go to hospital, only thing that I pray is, God give me the strength to change the things that I can still change, to accept the things that I cannot change. But most importantly, the common sense to know what things I can change and what I cannot change. If that is there with you, anxiety, tension, exam ke liye kabhi bhi nahi aayega. So take it as my word. Not only for exam, any part of the life. What can we change the things that suddenly come in our life as unprecedented contingencies? No. But what we can do, how much is there in my hand, how much is not there in my hand, what I can do with my hands available to deliver the solution. That if you keep in mind, you will be more successful doctor. Because tomorrow when you practice also, patient will have chest pain for about 5-6 hours. He will be just in the adjacent lane of your hospital, but he will not come to you. Already myocardium is completely damaged. Then he will come. All right. He already crossed the golden period. Is it your fault? No. But what will patient will say? No, it is your fault. Your diagnosis is not right. You misdiagnosed me. You are a commercial fellow. Blah, 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 blah. Don't care about that. Your priority is what? Can I do something to help this patient even if he is not happy with me? Right? So that ability to accept the things which we cannot change and do all effort to change the things which we can still change and have common sense to differentiate between the two is all that is going to make you a top clinician. That is the dream you need to have when you go to sleep doctor. So thank you so much once more for being patient listeners. Right away go to learnograph.com, download this Sprint 7 ebook PDF, and you have the 1000 points quickly summarized from 4 years of neetpg. Tomorrow I'll upload Sprint 8. It contains another 1000 high yield facts. Just run through the high yield facts bus without any prejudice. Wherever you feel that you can go back to any material you are studying, any coaching material, doesn't matter. Can you be able to assimilate wherever you are little leaky? Suppose tocilizumab, अरे भाई मुझे कुछ भी apps मालूम नहीं है, मगर tocilizumab पूछा, that means he will ask eculizumab, many maps. Every entrance में one monoclonal antibody map के ऊपर आएगा. For quickly revise. Don't waste time. Just 5 minutes में. फिर once more you come back. Okay, I know multiple myeloma. Okay, I know myelodysplasia. Okay, I know this. Oh, iron deficiency, sideroblastic anemia, beta thalassemia. I should know the difference. Where is transferrin saturation? Increase, decrease, ferritin increase, decrease. Then you go back to the table and then quickly revise and then come back. That's how you have to finish about 1,000 questions cursorily revised and filling the gaps quickly for the next 10 days, doctor. Good night. Enjoy this journey. There is no sweeter journey than preparing for entrance. Once you become a topper, you think life is happy? No, sir. As a consultant, how can I grab the patients? How do I advertise myself? How do I satisfy my patients? Once you become cardiologist, there will be about 1,000 cardiologists in the city you are practicing. You are one among them, right? But at this juncture, we feel, oh my God, there are some superhumans. There are no superhumans, doctor. They are all what you are now today, once upon a time. Good night, and we'll all see you tomorrow. Thank you.